Now, the diabetic patients are prone towards the development of the cataract, and that cataract needs to be removed. If that's involved, there is a sudden change in the vision, and usually the patient present with macular involvement much earlier as they feel like something is floating in their field of the vision, and that's what we called as. Do you know that diabetes mellitus is one of the top most causes of blindness around the world? And the reason for that is most of the people never really know that they are suffering from eye disease from diabetes mellitus. The thing is, first of all, in this video, we'll discuss about what are the different involvement of diabetes mellitus and eye damage. The next part would be, we will talk about the symptoms, and then the last part, we will talk about what we can do without medicine to take care of your eyes if you are a diabetic patient. The first thing is, in eye, if there is a damage by the diabetes mellitus, that can be simplified in terms of retinal damage, and there is direct toxic insult of the glucose and its products to the diabetic patient's retina. And the vessels are kind of flimsy, they are leaky, and the blood is tending to leak towards the interior, and there is a fluid called the vitreous fluid. Sometimes there is a bleed into the vitreous fluid too. There is a central area called macula. If that's involved, there is a sudden change in the vision, and usually the patient present with macular involvement much earlier as compared to the retina, because the rest of the retina will take time for the symptom to be appearing in the clinical sense. But if there is some involvement of the macula, the patient will present as soon as possible because it's directly interfering with the field of vision. Along with that, there are changes in the lens, and there is haziness within the lens, and that what we call as cataract. Now, the diabetic patients are prone towards the development of the cataract, and that cataract needs to be removed if the patient is having symptoms. And how and when, that is beyond the scope of this discussion. This is to be discussed by the ophthalmologist. Additionally, there can be glaucoma. Glaucoma is the increased pressure of the eye within the eye in the interior chamber, and the diabetic patients tend to have more chances of development of glaucoma. The final problem can be that there is a nerve that is taking the electrical signals of the vision from the eyes to the brain. It's called the optic nerve. That can be damaged with the diabetes mellitus, along with other nerves that are supplying the extraocular muscles, the muscles that are moving our eyes from right to left and top to bottom. If they are involved, even in that case, it will be difficult for you to see, or there will be doubling of the vision. So what symptoms can we expect if one or more of these problems are there in the eye? Let's suppose if there is a retinal damage, then gradually there is a reduction in the vision. But in macular involvement, there is a sudden drop of vision, and the patient can have a total loss of vision if there is a leakage of the fluid within the vitreous area. And this usually is covered when the patient starts to take some antiplatelet drugs, which are for the purpose of making the blood thin. But if there is already a leaky vessel within the retina, when the blood is just too thin, it's going to leak into the vitreous area, and that can create some problems. Along with that, some patients complain that they feel like something is floating in their field of the vision, and that's what we call as floaters. There can be actually the fluid within the eye that may be having some blood clots or some additional material that is exuded from the retina. Few patients complain that there is enlargement of the blind spot. There is a blind spot area in the field of vision. Wherever they see, they see an area that is totally black, and it's not showing what's in the field of vision. That's what we called as enlargement of the blind spot. That can also happen. Few patients complained about the night blindness. They feel like when there is dark, even after the evening time, they find it difficult to see. It can be associated with cataract It can be associated with so many other things that I have previously talked about in the earlier part of this video. So let's suppose, unfortunately, you have diabetes and these problems. What to do? You need to listen to your eye specialist, and whatever he or she wants you to do, you should do it. But additionally, you must control your diabetes. If you don't do that, none of the other things is going to work. Believe me. And to add to that, the control in blood sugar should be coupled with exercise, and the sugary foods should be reduced. If you are a smoker, you should start smoking. And if you are having some cholesterol issues, you must be controlling the cholesterol too, because the cholesterol, the rise in cholesterol and the other lipids, they tend to inflame the vessels, and that can lead to some problems within the retina. The blood pressure control is essential, because if there is more pressure within the flimsy vessels or the weak vessels, that is going to promote more of the blood leaking from the vessels to the interior fluid of the eye, that is called the vitreous fluid. I hope this video adds value to your life. Stay safe, stay strong, and be informed. Thank you.